All right. Thank you all for joining us today. This is the June 12th, 2024 All-Come webinar for Oregon's 1115 Medicaid waiver. We have a lot of updates for you this month, so I am going to dive right in with our agenda. Oh, the group polls first, then the agenda. All right. One of the things that we do at the beginning of these presentations is we collect two pieces of information. First, there will be a poll up that asks you about where you are coming from, where you are working and or living in Oregon. There's also an opportunity if you are not in Oregon, there is also a not applicable. If you serve the whole state in your work, there is also an opportunity to select that. And there is also every single one of the 36 counties of Oregon in this list. I see that we're just over at half of folks responding to the poll, so I'm going to keep this open probably for another 30 seconds or so. The reason why we ask about this is because we're trying to get a feel for if there are parts of the state that maybe folks are not tuning in from. I wouldn't say it's a problem to have overrepresentation from any part of the state, because the more the merrier for these all-come webinars. So we have quite a few folks coming from Multnomah County, for instance, which makes a lot of sense in Oregon. Also see a fair number of people from Clackamas. We have Jackson County representation, Lane County. There's a few of you who are the only representative of your county right now, so thank you so much for joining us. And if I can, oh yep, there we go. I think it just, are we now looking at the results? My apologies, it looks a little different on my end. So just a moment to,
yes.
Thank you
yes,
so much,
seeing the
Ellie.
results.
Just a moment to let you all see what we have collectively put into this poll before we move on to ask you what sectors you represent. And this question is, what sectors are you aligned to? It is a multiple choice question where you can select multiple categories. We're looking to see if our audience is largely comprised of community-based organizations, coordinated care organizations, if there are organizations that specifically consider yourselves to be, for instance, a tribe or tribal serving organization, a culturally specific organization, if you represent the healthcare or nutrition or housing sectors. There's also an opportunity to let us know that you are not affiliated with an organization. You're here not because of your work, but because of your interests or for some other reason. We also have options for local government. We have options for if you are an OHP member yourself or an advocate. And I have noticed we continue to have good internal folks in attendance as well. Ooh, sorry, Trevor, I accidentally pressed a button. My apologies.
And Jessica, it looks like we have some folks that can't see the poll.
People who can't see the poll. Oh, thanks so much. I would say if you are comfortable and you want to share publicly in the chat what sectors your work touches, I'm happy to read some out. My apologies. I think sometimes the poll can get closed, and once it gets closed, it's hard to reopen in Zoom. So the first question was, what county are you coming from or do you serve? And the second question is about what sectors your work is aligned with. And that can be something like a community-based organization, a coordinated care organization, If you'd like to give us more information about what type of organization, whether it's climate focused, culturally specific, healthcare, behavioral health, housing, local government, nutrition, if you're a state staff member who's here to get updates or to share updates, or if you're an OHP member or member advocate, you are welcome to put that into the chat if you feel comfortable. And I think we can go ahead and share the results now. Have to admit, it's not ideal to not see the poll, but I do love seeing a little more context to where you all are coming from. So thank you for the folks who have participated either in the poll or in the chat. Perfect. Okay. Let's go ahead and get into our content for today. We have quite a bit. So today we're going to start the way we always do with a quick background, just to make sure we're all on the same page. We have some information about climate and outreach and engagement benefits. We have a housing update, and climate outreach and engagement and housing are all part of the health-related social needs services that are part of the waiver. We also have some information on ways that through the waiver we are able to expand benefits to young adults with special health care needs. And then we'll round it out with a quick update on community capacity building funds, as well as an upcoming rulemaking opportunity if you are interested in participating in our rulemaking. And we're going to talk about future sessions. So with that said, let's get into the background. What is an 1115 Medicaid waiver and why are we talking about it today? First off, making sure we use a lot of terms interchangeably. You will hear us talking about Medicaid or about the Oregon Health Plan. Oregon Health Plan is Oregon's version of Medicaid. It's a state and federal partnership. And so there are ways in which there are structures that are nationally set, and there are ways in which we make it our own in each state. So you'll see it's called different things in different states. In Oregon, we call our Medicaid program the Oregon Health Plan, and it is free health coverage that's available to children, teens, and adults who live in Oregon. They must meet income and other criteria. And OHP is open all year round, so people can apply at any time. Next slide. I mentioned that Medicaid is this state and federal government partnership. The waiver itself is a way that we can ask the federal government to try new things and to waive some of the standard expectations, and really demonstrate what can work differently, to innovate and see how we can build our Medicaid system into something that better meets the needs of Oregon and better meets the needs of some folks who maybe we have not traditionally been able to serve as well as we'd like. So this is a process every 5 years where we try new things, we demonstrate what works and how it has worked, and then we return and negotiate all over again and set a new or expanded or slightly different set of things that we're going to try next time around. And this particular waiver process, it was officially approved in late 2022 and will go through most of 2027. Next slide, please. Some of the specific things that we are working within this 5-year process of the 1115 Medicaid waiver is that we are extending OHP eligibility for young children, youth, and adults. And part of that is creating continuous OHP eligibility and enrollment for children up to age 6, which means that once someone under the age of 6 is enrolled in OHP, they have protections that keep their OHP going, even if there are changes to that household's income, other things like that. There's a lot of new protections in place. That also includes 2 years of continuous enrollment for any OHP members who are aged 6 or older. If you've been to these events before, you likely have seen us talk a lot about health-related social needs, and that was also going to be true today. Adding in supports that use Medicaid dollars in ways that we haven't in the past on housing, nutrition, and also with climate supports and devices, and that outreach and engagement aspect of the work as well. And then something that I think for some of you, this might be the first time we're talking in depth about it, adding in that coverage for young adults with special healthcare needs up to the age of 26. So that's just a sampling of some of the really interesting things that we are doing through this waiver. And this also, I believe, is the part where I hand over. And I'm going to go to the next slide and double check that fact. Yep, this is where I hand it over to Jessie Wilson. Jessie, take it away.
Thanks, Jessica. Good morning, everyone. Jessie Wilson here, she, her pronouns, and I am the 1115 Waiver Strategic Operations Director. Happy to be back talking to you and discussing some of the benefits that Jessica just outlined. So as a reminder, there are new health-related social needs benefits that Oregon is allowed to implement. So that includes housing, nutrition, climate, and outreach and engagement services. Today, for these next couple slides, I'll be giving a brief reminder and overview of the climate and outreach and engagement benefits that are currently live and available to eligible Oregon Health Plan members. Next slide, please. So just a reminder of what these benefits include and what the goal is with these benefits. So also distinction, these are health-related social needs services. So these are separate from health-related services that maybe you have heard of that CCOs have the discretion to provide. So we're talking about health-related social needs services approved in the most recent 1115 Medicaid waiver. And so the first benefit I want to talk about are the climate-related supports. So the coverage began for these new services starting March 1st of 2024. The next slide will show the specific devices that eligible individuals may be able to obtain. So really these devices help give people or help people keep temperatures in their homes and healthy and clean air. Members with specific health conditions will be eligible. And so there are certain clinical risk factor criteria that individuals need to be able to meet to be eligible for these devices, as they need to be clinically appropriate and helping to improve or ameliorate a health condition that the individual may have. Also to note, or as a reminder, that these devices and HRSN services in general are only for individuals who qualify in certain transition populations. So they need to be experiencing a specific life transition. And those include adults and youth being released from incarceration, adults and youth discharged from institutions for mental disease, individuals who are currently involved in or have been previously involved in Oregon's child welfare system, individuals who are transitioning from Medicaid only to a dual eligibility status, so Medicaid and Medicare coverage, and then individuals who are homeless or at risk of becoming homeless would be eligible for ventilators, or would be eligible for some of these devices depending on their ability to use them safely and legally. Also want to note that young adults with special healthcare needs will be a transition population eligible for these services starting in 2025. And I believe some of my colleagues will be giving more information about young adults with special healthcare needs later in this presentation. So additionally, the coverage for HRSN outreach and engagement benefit also began in March of 2024. And this is a benefit that really helps engage individuals who may be eligible for HRSN services. So it's a way that local organizations can get paid for helping eligible people not only get access to health-related social needs benefits, but potentially other non-Medicaid benefits that they may need, such as services like legal, medical, and more. And the aim of the health-related social needs services, and specifically the two here that I'm speaking about, is to find ways for more support from community-based partners, help provide devices to individuals to keep them safe, particularly during extreme weather and wildfires, and then, of course, to improve health outcomes. Next slide, please. In terms of the climate benefit that's available, so there are 5 specific devices, and individuals may qualify for one of these, or it's possible that they may qualify for all 5. Really depends on their situation and the health conditions that they have. So air conditioners, air filtration devices, mini refrigerators, portable heaters, and portable power supplies are all HRSN climate devices that eligible members could potentially qualify for. Next slide, please. And so this slide is, I'm really happy to share this. We received some information about a member experience recently to show the impact that this HRSN climate benefit is already having on members. So we wanted to share this example, or this impact today with you all, to kind of highlight the benefit of this, and how it can be used to help improve outcomes. So recently, a care coordinator learned during an assessment with a call with an OHP member that several people in that household who were also OHP members had health conditions that would be negatively impacted by extreme heat or wildfire smoke. So specifically, the clinical conditions included cardiac issues, asthma, and medications that needed to be refrigerated. And so in order to stay healthy during times of extreme weather, the family had to stay at a neighbor's house to get the support that they needed. So the care coordinator was able to share with the member that they qualified not only for an air conditioner, but an air filter device and a mini fridge to store that medication that they needed at no cost to the member. So now the family is able to remain in their own home during extreme weather, because they're able to use devices that would help prevent further exacerbation of those conditions. And the member said that these benefits would drastically improve their quality of life. So we wanted to share this the story with you all today, and it's the reason we do this work, and we're really excited about these benefits, and want to make sure that as many members as possible can access them. At this time, I'm going to hand it over to my colleague, Callie Glenn Haley, who's going to talk a little bit about the housing benefit.
Great. Thanks, Jessie. Hi, everyone. I'm Callie Glenn Haley, she, her pronouns. I'm part of the OHA 1115 waiver team, and I focus on housing. I wanted to give an update on housing eligibility. And so, yeah, next slide. Great. Okay, so many of you may already be aware of the HRSN housing services. The services that are going live on November 1st include tenancy sustaining services. So this is basically our way of saying housing case management, medically necessary changes to homes to make them more accessible and safe. And this includes some home remediations, including extermination of pets, adding home modifications like adding ramps and grab bars, and help with kind of heavy duty cleaning. We're also including rent for up to 6 months, including past due amounts. So the total between arrears and kind of ongoing support being 6 months, utility setup costs and costs for up to 6 months, and storage fees. Next slide. So the eligibility for, and it's a little confusing because the eligibility is slightly different depending on the service. So to qualify for HRSN rent, utilities assistance, and tenancy services, a person needs to be currently housed, needs support maintaining their current housing, and has or will have a written lease or written agreement with the person that they are renting from. So this kind of makes us, this eligibility is in line with our preventative approach to help people stay in their homes, prevent homelessness. And in addition, they need to have an income that is 30% or less than the area median income in their area, according to the Department of Housing and Urban Development. And we have the link to what those income limits are below. And they need to attest that they lack sufficient resources or support networks to prevent homelessness. So for those of you who are familiar with the HUD definition of at risk of homelessness, you'll see that these two criteria, so income 30% or less and lack sufficient resources or support networks, those are the first two components of the at-risk definition according to HUD. And the kind of focus on the at-risk population is a requirement from our federal agency that we are working with. And in addition to this, have a clinical risk factor. So with this eligibility, again, we're aiming for a preventative approach to help people stay in their homes, targeting the people who are at risk of homelessness. Next slide. And if you've been attending these sessions, you may be familiar with our clinical risk factors already, but the clinical risk factors for housing are listed here. They're quite broad. So complex behavioral health condition, developmental disability, complex physical health condition, needing support with ADLs, activities of daily living, current or past interpersonal violence experience, repeated emergency department use, repeated crisis encounters, currently pregnant or postpartum, less than 6 months of age, more than 65 years of age. And so one or more of these clinical risk factors combined with those other criteria would make someone eligible for HRSN rent and utilities assistance and the other services, tenancy sustaining support. Next slide. So our eligibility for HRSN home modifications and remediation services going live on November 1st, 2024. And just to note, these services are somewhat restricted in terms of activities. So for home modifications, we have ramps, grab bars, and drawer pulls. And for home remediations, we have installation of synthetic blinds to prevent allergens, heavy duty cleaning, and pest eradication. So to be eligible for these services, a person must have one of those clinical risk factors and belong to one of the HRSN transition populations. And again, if you've been following along, you're probably familiar with these transition populations. Jesse mentioned them in the last section as well. Released from incarceration, discharged from a mental health facility, current or past involvement with the Oregon child welfare system, changing from Medicaid only to dual Medicaid Medicare coverage, and then again, this income that is 30% or less than the area median income and lacks sufficient resources to prevent homelessness, that at-risk category. And then finally, for home modifications and remediation, the home modification or remediation service needs to address the individual's health need. So there needs to be some sort of logic ensuring that the service itself is in fact needed by the individual. Next slide. Great. So examples of potentially eligible OHP members. A person with a qualifying chronic illness loses their job and needs help paying back rent while they look for new work. So they could be eligible for 6 months of rent. Someone needs help paying rent because they can't work during a hospitalization or recovering from an injury. A family is doubled up with friends and needs financial help to pay costs for staying in that housing. And in this case, they may not have a lease with the landlord directly, but they would have a written agreement with the friends that they're staying with. A family at risk of eviction due to a lack of upkeep of their home, and they need heavy duty cleaning services to maintain their housing and smooth things over with their landlord. A parent needs help paying rent while they have to take time off of work to care for a child with special healthcare needs. So those are some examples. And next slide. And I see the chat has been active, and I'll work on responding. So thanks so much.
All right, I believe I'm up. Hi, everyone. Good morning. My name is Liz Stewart. I use she, her pronouns, and I am a member of the team that is working on this expansion of benefits to young adults with special health care needs. Next slide, please. So as Jessica mentioned earlier, starting January 1st, 2025, OHP will offer more benefits to young adults with qualifying health conditions under a new Medicaid eligibility category within the waiver. And this is going to be called Young Adults with Special Health Care Needs, or YSHCN. Next slide, please. So who are young adults with special health care needs? And this is a category that is defined within the waiver and our agreement with the federal government for how we're going to do this. So these are young adults ages 19 to 26 with special health care needs who have or are at risk for ongoing conditions. So that includes physical, intellectual, or developmental disabilities, longstanding medical conditions. So that's things like asthma, diabetes, spina bifida, or mental health conditions, substance use, or neurodevelopmental conditions. Next slide, please. So a little bit about why we're doing this, why expand benefits for this YSHCN population. In Oregon, 1 in 5 children under age 18 has a special health care need. And these young adults with special health care needs typically need more health and social services than other individuals of the same age. And often young adults and young adults with special health care needs can actually lose coverage when they turn 19 due to changes in eligibility. And so what the waiver is actually going to do is provide YSHCN, young adults with special health care needs, with extra time to transition from pediatric to adult coverage and care and provide that consistency in coverage and care across this age range. Next slide, please. All right, so who qualifies as YSHCN starting in 2025? So this benefit is going to be rolled out by age group. So in 2025, young adults ages 19 and 20 who have qualifying conditions or needs will be eligible to enroll in the YSHCN program. And Oregon does plan to expand this YSHCN category to cover people up through age 25, up to their 26th birthday by 2030. And the ways to qualify for this program, in addition to that age range, are listed here on this slide. And this is what is outlined in our 1115 waiver. So the first pathway is to have 1 or more complex chronic medical conditions. The second is to have a mental health condition, substance use disorder, or neurodevelopmental condition. And the third is an intellectual or developmental disability. And then the fourth pathway is having what is called an elevated service need identified through a YSHCN eligibility screening tool. So those first 3 pathways actually allow us to identify folks who are currently enrolled in OHP who qualify for these enhanced YSHCN benefits based on having one of these conditions, and provide them with a smooth pathway into this YSHCN benefit. That fourth pathway with this screening tool is for folks who are new OHP applicants or folks who haven't had the opportunity to be diagnosed or receive treatment through OHP. We want to make sure that we can capture that and some eligibility based on needs as well. Next slide, please. So in terms of this eligibility screening tool, that fourth pathway, how does this work? So starting for 2025, all people ages 17 or 20 who are applying for the Oregon Health Plan through the ONE system will be prompted to answer screening questions to see if they qualify as YSHCN. And these screening questions will be available in the paper OHP application as well in multiple languages. And the screening questions can be used by young adults or their caregivers. The questions are optional. And one of the key things to know is that young adults don't need to have a diagnosis to use that tool or to qualify. It does screen for healthcare needs as well. And the background of these screening questions is that OHA, to develop these questions, OHA worked with OHSU's Oregon Center for Children and Youth with Special Healthcare Needs, or OCHN, to develop the tool. And OCHN worked with some existing validated screening tools and coordinated an advisory work group to review the tool and conduct cognitive pre-testing with users across 6 different languages. And again, that screening tool and that set of questions is being built into the OHP application. Next slide. So what benefits will YSHCN actually receive? So this slide shows on the left-hand side is sort of what folks who would qualify as YSHCN currently get on OHP. So currently, for this 19 to 26 age range, the income eligibility for OHP is at up to 138% of the federal poverty level. And when on OHP, folks can get EPSDT coverage, which I will talk about a little bit more in a minute, as well as enhanced vision and dental benefits. Those coverages end on the 21st birthday, and currently then folks transition into adult benefits. And currently there's no direct pathway for young adults with special healthcare needs to access health-related social needs services, the ones that Jesse and Callie were talking about, unless they are in one of those other transition populations and have those other risk factors. On the right-hand side is what YSHCN eligibility and benefits will look like starting in 2025. So the income range for YSHCN eligibility will be up to 305% of the federal poverty level. Folks on YSHCN will get EPSDT and enhanced vision and dental coverage up to their 26th birthday. And then, as Jesse mentioned earlier, young adults with special healthcare needs will be one of the covered populations for health-related social needs starting in 2025. So they will have a much more direct pathway to those services. They will still need to meet the other qualifying criteria, like having one of, for example, having one of those very specific sort of housing needs for the housing services. Next slide, please. All right, so I mentioned EPSDT coverage. So want to give a little refresher or orientation as to what that means. EPSDT is the Early and Periodic Screening, Diagnostic, and Treatment Program. This is a federally required benefit that provides complete healthcare services for children and youth under age 21 who are enrolled in Medicaid. So this is a national requirement. And in Oregon, as of January 1st, 2023, what this means is that all medically necessary and medically appropriate services must be covered for OHP members under age 21 regardless of where that service or diagnosis is placed on the OHP prioritized list. So determinations of coverage must be made based on medical necessity and medical appropriateness for the individual member. And then the key thing in relation to YSHCN is that starting in 2025, as I mentioned, young adults with special healthcare needs will have this EPSDT coverage up to their 26th birthday. Currently, that cuts off at the 21st birthday. Next slide, please. All right, and I think this is our last YSHCN slide, but we wanted to give a little snapshot of sort of the numbers that we're anticipating for folks that will qualify for YSHCN in 2025. So there's kind of two groups here. So again, this is the 19 and 20-year-olds that will be eligible in 2025. And so one group is folks who will be newly eligible for OHP enrollment because of YSHCN, because of that change in income eligibility, in addition to the other qualifying health conditions and needs. And for that group of newly eligible for OHP, we're looking at about 5,800, just under 6,000 folks newly coming onto OHP in 2025 because of this program. And for current OHP members, so currently enrolled, but who will qualify for YSHCN and then be able to move into these expanded benefits and retain those coverages to age 26, just over about 16,000 people based on our estimates. So a total of about 22,000 folks coming into this YSHCN program in its first year in 2025. And with that, I think I will hand it back to the next presenter.
Thanks, Liz. Okay, I am going to be talking about the community capacity building funds, which, as a reminder, Oregon is allowed to spend up to $119 million in community capacity building funding, or CCBF. And this funding is to support entities that will become health-related social needs service providers, to really help these entities develop what they need to be able to participate in the Medicaid delivery system and deliver the HRSN services to qualified OHP members. So just also as a reminder, or maybe it's new information, coordinated care organizations will be administering these funds to eligible community partners during set funding windows in 2024 and 2025. In my next slide, we'll preview a timeline of that. CCOs will be required to report to the state on key elements, which we will use to inform subsequent years of community capacity building funding opportunities. And then also wanted to note that tribal governments will be receiving a set-aside amount of this funding that will be administered through a different process, not through CCOs. Okay, let's take a look at the next slide, which is the timeline for community capacity building fund distribution, grant application and funding. So as you can see on this timeline, this funding program was launched in January, and then through the spring, there was promotion of the grant program to eligible HRSN providers or potentially eligible providers. The application window for the first round of funding opened in March, and those applications were due to CCOs at the end of May. So CCOs are currently reviewing those applications, and then they'll be releasing the funding in batches. So the first batch CCOs will finish reviewing those applications by June 17th. And then there'll be a second batch of applications by August 1st that CCOs will be reviewing. And then eligible entities will be receiving notifications of whether they are eligible for the funding, and those will go out by August 1st or by September 15th for that second batch. And then the funding will be dispersed starting August 31st through October 16th. So as soon as the providers receive these funds, they are eligible to use them as soon as they receive them. And then we'll be opening additional funding windows in 2025. So if this is new information to you and you think that you may want to apply for community capacity building funding down the road, there will be an additional funding window where you'll be able to do that. Let's take a look at the next slide, please. So we will be sending out a community capacity building fund feedback survey for the 2024 process. We're interested in hearing from you and inviting organizations to take part in the survey. The survey will be used to help us make improvements for our next round in 2025, where we'll be reopening the applications and having a review process and dispersing funds again. So I'm really interested in hearing your feedback. Even if your organization didn't apply for community capacity building funding, if you've never heard of it, we still welcome you to fill out the survey so that we can better understand how to reach different audiences or how to improve the process as a whole. There will be a link to the online survey that we're going to be sending out very soon, and we will keep that survey open until till June 28th. It will take about 15 minutes of your time to complete. So again, even if you haven't heard of CCBF or you did not apply, we still want to hear from you if you're interested, just so we can make this process more accessible and improve it for 2025. So more to come on that, and we'll be sharing that link. Next slide, please. So just want to provide an update on something happening this week. Rulemaking on Friday, June 14th from 1 to 4. We will be convening a rules advisory committee. So just a reminder, this is the process for sharing proposed updates to rules and hearing feedback on the proposed changes. So you're welcome to attend as a member. If you're interested in becoming a member, you can reach out to me specifically, and I can put my email in the chat, or you're welcome to just attend as a member of the public as well to comment on rules. If you're not able to attend the specific meeting, that's fine. You're always welcome to send feedback over email after the RAC. There's a 21-day period where there's public comment allowed on rulemaking. So no worries if you're not able to attend, you can still review the proposed changes and submit feedback via email. So we'll send the contact information on how to do that as well. So specifically what we're going to be covering in this Rules Advisory Committee this Friday are rule updates regarding the health-related social needs implementation. So we'll be covering proposed rules regarding the housing services that Callie talked about, as well as nutrition services and the outreach and engagement updates. So outreach and engagement under HRSN is currently live, but we'll be expanding the benefit to include additional activities. And so the rules will cover that. So we have here in the table sort of the description of proposed changes. We'll be updating some of the HRSN definitions. A lot of the changes will be made to the HRSN service delivery. So that's Rule 2000. And then we will be doing some updates to clarify service authorization timeline for HRSN services, for Rule 3835, and then providing some updates on provider contracting and credentialing, which includes the housing and nutrition updates. The additional rulemaking regarding the young adults with special health care needs will be scheduled soon, so that that rulemaking process will be separate from what we're doing this Friday. So we will send out some more information if you need to have it for the RAC happening this Friday on how you can participate, and if you're not able to participate, how you can still submit your feedback. And there's a link on this slide as well to learn more about rulemaking opportunities. I think I am turning it back over to you, Jessica.
Thank you so much, Jessie. And thank you all. You've made it this far. I'm going to be quick here so we have at least a little bit of time for open conversation. But just wanted to share a little bit of information about future All-Come sessions. We, first off, are taking summer break. So we are taking July off. Next slide, please. And so there will be no All Come or Para Todos webinar in July. This series has where you registered once and you continue to get information to join. This ran through the first half of 2024, and we will start a new series starting in August. So we will be sharing that registration link out for all of the folks who have been participating here. It'll also go up on our website. We will probably be sending that out in lieu of a webinar itself in July. So look in your inboxes for information very soon. We also continue to have other ways to make sure you are in the loop on everything that is happening with the 1115 Medicaid waiver here in Oregon. So I do specifically also want to call out the newsletter as a really excellent opportunity to get regular updates. I believe that's every 2 weeks. And we have a slide that has a link. It's also available on our public website. And I can make sure to drop a link into the chat for you all. And it's 10:53. So if we go to the next slide, I want to check in and see there's been a lot of activity in the chat. I want to see if there are any questions folks want more information on. If there's anything from our presenters that you want to say out loud that you've written in the chat. Gonna check for hands and check for interested presenters who want to speak up. I don't believe I see any hands up. There is so much in the chat that I'm not sure I could do it justice just trying to read through it very quickly out loud. But I do see, I see one that I do want to make sure I say out loud, which is we've talked about a lot of different benefits, services, supports that people may be able to receive through this waiver. And I want to affirm that in order to be eligible for any of these services, someone has to be enrolled in the Oregon Health Plan. So they need to be an OHP or Medicaid member here in Oregon. For the health-related social needs, they do need to be in one of the transition populations, as well as meet clinical and social risk criteria. And we will have this recording available on our waiver website. There is a specific link that goes to all of our past newsletters, as well as all of our past webinars. I also see that Jesse's putting some really great information about how to participate in the Rural Advisory Council Committee. Goodness, my words today. The RAC, as we call it, because we love our acronyms at the state. Jesse is a great point of contact for any questions you may have about participating in rulemaking. There is a direct Zoom registration link that Jesse has put in the chat. And there is also a more generic website for how to learn more about what RAC processes, those Rules Advisory Committee processes look like. And so I'll make sure to get that in the chat as well. My ability to talk and type is limited today. You all were so active in the chat and now everyone is so quiet. So I want to check one last time to see if there's anything that maybe any of you felt wasn't fully answered. You wanted a little more clarity. Something that is just coming to mind now that isn't yet in the chat. Wow, we answered all the questions. Oh, I do see a question about how long a person can receive assistance with utilities or rent. Kelly, can I ask you to chime in here?
Yes. Oh, right there. So it's 6 months total. And that could include any combination of back pay of rent and ongoing rent for a total of 6 months. So if a person has 3 months in back pay due, and then needs 3 months more of support ongoing for a total of 6, that's okay. If someone needs 6 months moving forward, total of 6, then that's also okay. So 6 months.
Thank you so much. All right. Well, let's see. I think there's one more slide that has some contact information. And look at that, 10:58. We're just about right on time. We continue to be available through this inbox that is listed here at 11 or 1115waiver.renewal@odhsoha.oregon.gov. There's also a homepage for the waiver. There's now quite a few other tools, PDFs, and landing pages that talk about specific parts of the waiver, such as the communications one that I put in the chat. There's a health-related social needs landing page. There's a climate landing page specifically. I believe we have a provider page up as well. And that last link here is to sign up for updates through our newsletter. And someone is asking how to contact us for the different moving parts of the waiver. And I will say right now that central inbox is the best way because it will then get routed to the right person who will respond directly to you, or will work together to get you the answers you need if it's something that crosses the expertise of multiple people. So I think that right now, other than perhaps another inbox that is focused specifically on community capacity building funds, we are routing just about everything through this waiver.renewal inbox. And that's the best way to reach us if you want to do so via email, or at least to start the conversation, and then we'll connect you. All right. I'm going to go ahead and call it. Thank you all so much. We had a lot of information this month. We will not see you in July, but we hope to see you again in August. And we'll get you more information about what that looks like and how to register very soon. Thank you so much. Have a great rest of your day, everyone.